Hello everyone, welcome to SRK lecture, which is, as you all know, Samjho Ratto Karo. It's not Shah Rukh Khan but inspired from him. Now in this is not a lecture per se, right? This is where I teach you how to attempt a question, how much to learn from a topic, so that you never make a mistake in paper and you become SRK of your entrance exams. Right, so let us start with the topic, everyone. The topic is very confusing yet very easy. Craniosynostosis syndrome. I am sure you all know what are the craniosynostosis syndromes, where there is early fusion of the skull sutures, right? So this is again a very important MCQ. What is craniosynostosis? That is early fusion of the sutures resulting in various kind of skulls: acrocephaly, cone-like skull, brachycephaly, epidiameter is less, right? Tower-like skull, many other types, right? So let us do. In this beta, you have to know, have to know Apert syndrome, Carpenter syndrome, Clausen syndrome. This is utmost important. With this, you have to know little bit about Pfeiffer syndrome and just the name Shortzen syndrome. Now in this chart, everyone, first thing which I want every one of you to learn is that only Carpenter syndrome is autosomal recessive. Apert, Clausen, Pfeiffer, all are autosomal dominant. So if in a question you see a syndrome with the various symptoms which we are going to discuss and you see autosomal recessive, finish, question over, right? Because none of them is autosomal recessive except Carpenter. First thing. Second thing I want all of you to learn from this particular table is FGFR2 gene mutation. So Apert and Clausen beta, they occur because of mutation of FGFR2 on chromosome number 10. What is FGFR2? Fibroblast growth factor receptor. FGFR3 is also involved, but in Apert FGFR2 is utmost important, right? So FGFR2 and everything is autosomal dominant except Carpenter. Done, everyone? Okay, so let us start with the first syndrome, which is Shortzen syndrome or Sétre-Shortzen syndrome. It is most prevalent craniosynostosis syndrome according to the pediatric neurology books. It is autosomal dominant. And third thing which you have to know, the most common gene mutation here is twist gene. So you twist with Shortzen. That's it. Features beta, craniosynostosis, you know, partial syndactyly, ptosis and shortened fingers. Features of Shortzen are not important. But what is important is the three things, that yes, it is a craniosynostosis syndrome, most common, and twist gene. So learned, everyone? Let's move forward. Clausen syndrome, very important, right? So now it is the second most common craniosynostosis. First is the Shortzen, but if in the option Shortzen is not there, they say which is the most common craniosynostosis: Apert, Clausen, Pfeiffer, Carpenter. So you know what to mark. You know it is Clausen. Learned? Good. Then it is autosomal recessive. Am I right? No, only autosomal recessive is Carpenter. So it is autosomal dominant. FGFR2 gene. Done. We learned it. Now what are the features, everyone? You will get a X-ray like this with the lateral view, right? And you will observe copper beaten appearance. Now everyone, just imagine there is a copper sheet and I am beating it, right? How will it look? Similar look we see on the skull X-ray. Why? Lateral skull X-ray, especially, lateral, you will get in your questions. Why, beta? Because in this kind of syndromes, the cranium is malleable. So when the brain grows, it grows and it makes markings. And what is that marking? Copper beaten silver or metal beaten skull appearance. Learned, everyone? This is a question from your last year NEET, recent NEET. Okay, so what are the other features? We know craniosynostosis, brachycephaly, we know that, bilateral coronal suture fusion, right? So we get acrocephaly, severe propoptosis. Can you see, beta? The eyes are out. Propoptosis, just like Graves' disease. Then strabismus, maxilla and mandibular problems are there, small maxilla and mandibular prognathism, right? That you are going to see even in the Apert syndrome, so not very much. Important line to learn. Important line to learn is beaked nose and cervical spine abnormalities and hydrocephalus. These are your cue points, everyone. So the patient has acrocephaly, brachycephaly with propoptosis, hydrocephalus, copper beaten appearance, then it becomes Crouzon syndrome or Crouzon syndrome. Now everyone, every picture, please remember these three pictures, they have all come in rotation in your exams. So even this picture has come in your exam. So beta, when you see a picture like this, right, you read what has been given, right? So Crouzon syndrome, autosomal dominant, first brachial arch is involved, that is why maxilla and mandible are being affected. Simple, this you know. How to recognize is the purpose of SRK series. See, additional features in this particular patient, we are going to see partial or no syndactyly. Syndactyly means fusion of fingers, no or partial syndactyly, right? We see low set ears. See where your ears are, they are little lower in the Crouzon syndrome. Hearing loss, craniosynostosis, propoptosis, exophthalmos, hypertelorism means this distance between the eye has increased. Sit cornea, that is what? That is beak-like nose, very important. External, that's strabismus, you can forget. The two heart conditions which you see in a Crouzon syndrome patient is PDA and you see aortic coarctation, right? So this question can come. So what is the heart problems that you see? PDA and aortic coarctation. Maxilla and mandible will be affected, right? Hypoplastic maxilla and prognathic mandible. And we are going to see the cervical problem as well. Done. So this is Crouzon syndrome. I am going to make you learn, don't worry. In SRK series, you already know this much. My work, my job right now is to make you learn it, right? So I will make you do that. Okay, just wait. Apert syndrome. Apert, as I am saying apert, what is the word coming to your mind? Apple. Apple is favorite of kids and infants. You know, they wear mitten. What is a mitten? You know, mitten is just a glove for the infant, you know, so that the infant doesn't put the fingers in his mouth. So beta, in this apert, apple, infant, mitten. So in this you see mitten hands, fused fingers, important. You see syndactyly. So now you have a patient who has acrocephaly, brachycephaly, synostosis plus mitten hands, fused hands. It is Apert syndrome. It cannot be Crouzon. Why? Because in Crouzon we do not see syndactyly that much. Okay. Next, it has severe mid-face hypoplasia. See this beta. Mid-face hypoplasia is present in both Crouzon and Apert. But in Apert it is marked. So if they say marked severe mid-face hypoplasia, Apert. Then this we have done. Mitten hands, progressive calcification of the spine and the limb ligaments. Right, spine may be involved in Crouzon also, but in Apert a little more. Right, then cleft and high arched palate. Palate may be involved in the Crouzon syndrome, but in Apert it is very severely affected. In Crouzon it is plus minus also. It is not involved also. Right, then what is the classical triad of Apert syndrome? Craniosynostosis, early fusion, mid-face hypoplasia and bilateral mitten hand syndactyly. Done. So now everyone, Apert and Clausen both are autosomal dominant. In both we see brachycephaly, acrocephaly, correct? Am I right? In both you see maxilla and mandible problems. Mandible is prognathed, maxilla is hypoplastic because it is of first pharyngeal arch is affected, right? So these are the common features. The uncommon feature is the syndactyly, number 1. Why? Because in Apert we see syndactyly, in Clausen no, we don't see, or we see very less. Correct? Learn. Spine is more involved in Apert. Palate is more involved in Apert. Next important point is mental retardation. Everyone, if you know the same symptoms are given, with that they write mental retardation. They don't give you mitten hands. They write mental retardation. Please remember, the Clausen syndrome is like a crown, like he's intelligent. Right? So he or that particular child doesn't have mental retardation. Mental retardation is a feature of Apert and Carpenter. Done? Okay. Now few more important images, everyone. So Apert syndrome is acrocephalosyndactyly 1. Clausen was ACP. You know, these are the syndromes which have been named ACP syndromes, right? ACP. Right, like in the police. So ACP syndromes, they are due to the first brachial arch. So this is ACP 1. Clausen is ACP 2. Now, not much important. What is important? How you will identify, right? So in this we see Apert early synostosis. We see triangular facial defects, high arched palate, syndactyly, mandible prognathism, and hypoplastic maxilla, as I told, common. So done. Can you now differentiate? Yes. Now I am going to give you a magic chart also. Next syndrome is beta Carpenter. Now first differentiating feature is that it is autosomal recessive. Rest all are autosomal. Yes. Now key feature, beta, please remember, Carpenter has to do a lot of handwork. So won't it help? Won't it be a blessing if the Carpenter has more fingers to work? Right? So Carpenter syndrome has been, in this, Carpenter has been blessed by having so many fingers. Right? So in this, the first thing is polydactyly. Polydactyly. So in a question, there is acrocephaly, brachycephaly, syndactyly, all other features, the facial features, and they write polydactyly. Finish question. It is Carpenter, right? With mental retardation. So beta, in Apert they will always give you mitten, apple, mitten. In Carpenter they will always give you polydactyly. Plus they will give you polydactyly. Plus they will give you soft tissue fusion. Right, these are the two key words for you. If you have the other features of acrocephaly, brachycephaly, maxilla, mandible, all those palate problems, but you get these points: polydactyly and soft tissue fusion of the fingers. That means fingers are fused only by the soft tissue. It is Carpenter. Right. Next is clover leaf like skull. See, in this slide I can explain what is it. So in this you see acrocephaly, correct? Next, you see a flat nasal bridge, beaked nose, Clausen. Then mid-face hypoplasia, Apert. Flat nasal bridge, Carpenter. Syndactyly, polysyndactyly. Syndactyly is also present, polydactyly is also present. Now, what is clover leaf like skull? The skull X-ray looks like a clover leaf. See beta, this is a clover leaf. Plus, see, these are the number of fingers. In the X-ray also you can see the large number of fingers, right? So this is a classical figure of Carpenter syndrome. Copper beaten, Clausen, and clover leaf, Carpenter. Done? Okay. Now this is beta your magic chart, everyone. Please note this in your 20th notebook, the SRK notebook. Apert, Clausen, Carpenter, how to differentiate in a question. Now in the question, you are going to start with the brachycephaly or acrocephaly. That means they are going to say the anteroposterior diameter is reduced or the child has conical skull, or they will give you simple brachycephaly, acrocephaly. With this, Propoptosis, exophthalmos, polydactyly plus minus, syndactyly plus minus, right? No mental retardation, no palate abnormality or little bit abnormality, partial syndactyly or not syndactyly or partial syndactyly, mild prognathism but with or without hydrocephalus and copper beaten skull. All these are cue points of Crouzon syndrome. One more, beaked nose. Crouzon syndrome. Done. Next they give you, there is a patient of brachycephaly and acrocephaly with syndactyly fused hands, mid-face hypoplasia. Then that child has mental retardation. Anti-mongoloid features, that means the palpebral fissures are slanted, palate abnormalities, syndactyly, and it has fusion of the hands or the fingers, right? Or it has mitten hands, and they give you that particular image. X-ray mein ya वैसे, they give you a mitten hand. It is a pert apple, a pert apple baby. Baby wears the mitten, right? If they give you the patient has brachycephaly, acrocephaly, flat nasal bridge, polydactyly, first bell should ring. It is Carpenter. Clino means tilted fingers, and mental retardation, Carpenter. So beta, mental retardation is present in Apert and Carpenter. Syndactyly is also present in Apert and in Carpenter. In Carpenter we see soft tissue fusion as well. So this can be your cue word. And polydactyly mein beta, your cue words will be pre-axial polydactyly or central polydactyly, that means in the middle there is an extra finger, or post-axial polydactyly. Now you are going to see the Google images of pre-axial, central, post-axial, polydactyly, and message me Hrithik Roshan has which polydactyly, right? So in this beta, pre-axial polydactyly or pre-axial syndactyly word is there, that there was an extra finger and it has fused. If these words are there, they are Carpenter. ठीक है? Or in Carpenter, soft tissue fusion word is there, then it is Carpenter syndrome with brachy, with acrocephaly, with mandible, with maxillary problems, because first pharyngeal arch is affected, right? So this brachy, acro and mandibular problems, maxillary problems are common to all the three. Differentiating features, everyone. So now quickly answer. Beaked nose, yes. Mid-face hypoplasia with mitten hand, yes. Flat nose with polydactyly, pre-axial, syndactyly, soft tissue fusion, Carpenter. Done. Now few important points about this beta. Crouzon never shows mental retardation. So mental retardation question is there. Crouzon should be out of your mind. Apert and Carpenter. Palate abnormalities plus minus, syndactyly partial plus minus. AR inheritance, autosomal recessive. So if they give you a pattern which is autosomal recessive, right, this is very important. For this you watch my YouTube video on how to differentiate autosomal dominant. Recessive inheritance is only in Carpenter. Mitten hands is only in Apert. It can be in Carpenter, but Apert is your apple child mitten, correct? So these were your syndromes with syndactyly. One more beta which you just should know, because it might be asked, right? Important are Apert, Crouzon and Carpenter, but Pfeiffer syndrome beta, please remember, because it's a beautiful image, examiner might be tempted to give it to you. If you see a towering skull, a tower-like skull, right, and you see hypertelorism, and you see a short, broad thumb, right, there is a thumb which is very, very short and, right, broad in a picture, and you see a towering skull or turicephaly, that is tower-like skull, hypertelorism, gap is increased, and short broad thumb with FGFR2 mutation, then and with acrocephaly, brachycephaly and all that, then it is Pfeiffer syndrome. It is due to FGFR mutation on chromosome number 8. Carpenter was on chromosome number 6. Apert and Krausen were on chromosome number 10. Right, so this is how you will differentiate between all the craniosynostosis syndrome. Now you have understood, you have learned. Now is the time to do some questions. So let us do some questions, everyone. A child is suffering from acrocephalosyndactyly, premature closure of coronal suture, and this is being given. This is being given, this is like a copper beaten skull, yes. But because see beta, copper beaten skull will happen in almost all the craniosynostosis, but Krausen ke saath the name has always been attached in the MCQs. Right. So now, but with this, you see syndactyly. Oh my God. Syndactyly. Can it be Krausen? No, it is Apert syndrome. Done, everyone. So this and Pfeiffer को बेटा specially आप तभी देखना आंसर में when towering skull tuberculosis is being given और thumb का question has come. Right, when the thumb is there, then it is Pfeiffer. So it cannot be Pfeiffer, it is Apert. Next question, read and answer and then I'll explain. Polydactyly craniosynostosis, late closure of fontanelles is an example of, yes, you are right, Apert, because this is the only craniosynostosis. Next, disorder characterized by, beta answer should come from you, simple. Right, because that is the purpose of SRK series. Craniosynostosis, polysyndactyly of feet, scalp defects and syndactyly of soft tissues. I have 2 Q points, soft tissue and polysyndactyly, that means poly fingers and they are being fused. It is Carpenter or Krausen? Answer. Yes, Carpenter is blessed to have more fingers. Next, the disorder characterized by craniosynostosis, craniofacial anomalies, severe symmetrical syndactyly, cutaneous and bony fusion with preaxial syndactyly and variable soft form syndactyly. That means these are the 2 Q forms. These are the 2 Q points which you have to look forward in the question. And this is again Carpenter. You might get confused, okay, ma'am, it can be Apert also. Yes, beta. But these Q points, beta, soft tissue syndactyly, preaxial means there has been extra finger also. So preaxial polydactyly. So this, tilts the answer more towards Carpenter. Right. Next, light bulb shaped, cone shaped is in, very good, in Krausen. Even these syndromes are very important. So please read from your oral pathology. Now which suture closes first in Krausen syndrome? It is coronal suture, bicoronal sutures. A 7-year-old boy presents with short skull, propoptosis, narrow maxilla, mid-face deficiency, hypertelorism, supraorbital ridge and high palatal vault. Now beta, now you will say, ma'am, Krausen you have told no palate. Beta, plus minus. Mid-face deficiency, ma'am, you told Apert. No beta, Krausen also has mid-face, but major, severe deficiency is in the Apert. Right. Now the lateral ceph has been given, and can you see the copper beaten appearance? Yes. So the answer becomes not this, not this, not this, Krausen syndrome. Done. Next, last question. Young child presents with hypertelorism, hypoplastic maxilla, brachycephaly, propoptosis. See beta, propoptosis exophthalmos is a feature of Krausen, and they have given you an X-ray. X-ray may obviously, if it could be made out, then it is a copper beaten. If you cannot make out, it's okay. Look at the option, na. Don't try to find the answer in the X-ray. Look at the option. Can it be this? No. Can it be this? No. Can it be this? Yes. Can it be this? No. So the answer becomes again Clausen syndrome. Now this was SRK lecture on your various craniosynostosis. Now what is the aim of SRK lecture, everyone? The aim is, after this SRK lecture, none of my student should make this question wrong, and that is a deal. So deal, everyone. Now none of you should do this question wrong. Done. And every one of us should say we are the best. I am the best, because maybe, when you say I am the best, you are filled with energy and you really become best. Thank you, everyone. For many such SRK lectures, you can log into our app, BDS to MDS app, and you can join our courses, because these SRK classes are free, plus they are regular for our regular students. Thank you, everyone.